Let's win OET. A guide for OET aspirants.
Hi everyone, welcome to my YouTube channel, Let's Win OET. Here is another speaking video. Thank you so much for all the support you are giving. Your responses are my inspiration to upload new videos.
Good afternoon. My name is Samuel Johnson. I'm the interlocutor for the OET exam conducted on the 6th of March 2021. Our entire conversation will be recorded for evaluation purpose. Tell me your full name.
My full name is Hannah Matthew.
Can I have your passport, please?
Yes, here it is.
Tell me your candidate number.
Yes, my candidate number is 3524552.
Okay. Now I'm going to ask you a few warm-up questions. It will not be assessed. Are you ready?
Yes, I am.
Tell me about your professional background.
I am a nurse by profession. I completed my nursing degree from Jawaharlal Institutions of Medical Education and Research in 2018. Currently, I have 2 years of clinical experience in ICU from a reputed hospital in Delhi.
Why you choose nursing as your profession?
It was my ambition. It's all started when I was a teenager. A few years before, I had to spend a few days in a hospital with some health problems. I cannot forget the nurses there who provide the utmost care and support. It helped me and my parents to overcome that difficult situation. I felt honored for their job. Since then, I started to dream to be a nurse, and I would like to provide care and mental support for others.
Okay, tell me your routine working day in hospital.
I always start my duty with prayer. I reach my department on time. Then I check the crash cart and update the ward inventory. After that, I'll approach my allocated patient and will take the handover from the previously allocated nurse. I'll never forget to maintain a good rapport with patients from the beginning. I'll help them to meet their needs, and medicines will be provided on time. I'll attend the doctor's rounds and document everything. When my duty will be over, I'll give handover to the next shift nurse and leave the ward.
Alright, that's the end of your warm-up section. Your role-play card numbers are role-play card 1 and role-play card 6. Here is your first role-play card. You have 3 minutes to prepare. Your time starts now. I'll stop you when the time is over.
Good afternoon. My name is Hannah, one of the registered nurses working in this clinic.
Good afternoon.
May I know your name, please?
My name is Samuel Johnson. You can call me Samuel.
Okay, Mr. Samuel. What happened to you?
Nurse, I was in my garden and suddenly I started to feel a burning sensation on my face. A few hours later, swelling also has appeared. I'm quite afraid of it.
I can see some swelling on one side of your face. Don't worry, we can manage it. At first, I would like to ask you a few questions to know a little more about your condition. Then I will tell you about the possible treatment and causes. Is that okay with you?
Alright.
Thank you. When did it start?
4 or 5 hours before.
Did you have breathing difficulty, nausea or vomiting following that incident?
No, nurse.
How you can describe the feelings in the face now?
It's horrible. I have an itching, burning sensation and it is hot to touch.
Do you have any known allergies to any particular things?
No, I don't think so.
So you were in your garden and started to sense unusual feelings on your face. You have a burning sensation and itching now. Is there anything else you would like to add to this?
No, and it is for the first time.
Well, as per the initial assessment, I suspect that you have an allergic reaction. It happens when the immune system reacts abnormally to a foreign substance. Foreign substances or pollen from trees, some kind of grass or plants, and dust. Sometimes UV rays from sunlight and climate can also cause it. What do you think about it?
I do think so now. I was cutting some of the branches. So, is there anything to help me?
Of course. We have a lot of treatment options. Firstly, the doctor needs to consult you and will do the clinical assessment for the definitive diagnosis. Then he will prescribe you some medicines. Most probably antihistamines. It is a class of drugs commonly used to treat symptoms of allergies.
Okay. Please make it fast.
I can understand your situation, Mr. Samuel. But I'm sorry to tell you that the doctor is quite busy with some serious patients and you can see him within 30 minutes.
But I feel so difficult, nurse. So, is there anything you can do?
Definitely, I'll try to make you more comfortable. Ice packs are best to reduce swelling and unpleasant sensations like this. So, I can provide that. And I can help you to see the doctor as soon as possible. Is that okay for you?
It's quite difficult for me to wait for the consultation.
I do really understand your concern, Mr. Samuel. I know that you are going through a difficult situation. However, please try to understand that the emergency department is a little busy today and the doctor is seeing a serious case that needs urgent attention. I can assure you that you will not go through more trouble as the doctor will come soon and he will provide the appropriate management.
Alright, can you tell me one thing? How long it will take to get back to my normal face?
Your concerns are reasonable. Normally, it may take a few hours to a few days to disappear. If the exposure to the allergen continues, allergic reactions may last for longer periods such as a few weeks to months. So, up to the complete recovery, you can stay away from the garden, if it's possible.
I'll do that.
That's good. I can provide you with a few suggestions to prevent further occurrence. Do you want to hear about that?
Of course, it will be helpful.
It is apparent that you got allergic effects from your garden. So you need to be cautious while doing gardening. Firstly, avoid touching your eyes or face when doing yard work. Then, you may also consider wearing a mask to reduce the number of pollen spores that you breathe in. Lastly, leave gardening tools and clothing such as gloves and shoes outside to avoid bringing allergens indoors. Will you be able to do these things?
Yes, for sure.
Okay. Do you have anything else to clear?
No, nurse. Thank you.
You can take rest here. If you need any help, you can just press the buzzer. Thank you.
Okay. That's the end of your role play.
If you find this video helpful, please don't forget to like, share and subscribe. Stay tuned for more useful videos.